What was the first moment that made you realize, we can disrupt the healthcare industry or help it?
Well, yeah, that's exactly why. Because people wait forever to see a doctor. It's difficult to access care. We understood that patients seeing a doctor by video from home was going to be a no-brainer for patients. Why wouldn't you want to, if you could, not have to drive anywhere, not have to drive hours if you're rural, not have to fly out if you're northern, and actually see someone by video? But we want to validate it, so we did questionnaires. 100% pretty much of patients said, yeah, I would use this service.
Like here we are, right? 2026, and the lifeblood of healthcare, is still faxing, right?
You shouldn't know more about your pizza delivery than you do about your prescriptions.
Yeah.
You tell Domino's, you go on and you're like, oh, look, they got it.
Yeah,
they're preparing it.
Bob's making the pizza, right?
Right,
you understand that.
Yeah.
We can't tell you that your prescription was at least being filled.
Even received.
So I guess the first question I have for you is how you got started in this business, because, obviously I've been to the doctor or any healthcare system a number of times, hospitals, walk-in clinics, and every time I go, it feels like, there's a lot of patients and the hours, the wait times are long, and there's just not enough doctors, nurses, things like that. Obviously you guys saw something here. What was the first moment that made you realize, we can disrupt the healthcare industry or help it?
Well, yeah, that's exactly why. Because people wait forever to see a doctor. It's difficult to access care. And I'm a pediatrician by training. And so I see it firsthand.
Right.
That people have difficulty to accessing care. And like any good idea, as Dave would always say, it started at the gym because we've done a lot of projects together. And so we were at the gym. We were discussing this.
Nice.
Love that. There are other companies that did virtual care, but through private pay, through insurance. And the governments started allowing for doctors to bill publicly for virtual care. So we decided this is a good opportunity to do something different, allow people that are more underserviced to get access to care. So we started QDoc, and it basically is like a Uber for medicine. So you go online, you click a button, multiple providers get notified that you're ready to be seen. The first provider to click, I want to see you, you get a video connection with.
Right.
And you have that video connection. You can use your phone or a tablet or anything. And then you have a video connection with them. And the doctor during that visit can do send prescriptions over to your preferred pharmacy, which can get delivered to you. You can get lab work done. You can do x-rays or x-ray recs, so they can go to any x-ray department in the province. You can do referrals if they need it. And they can also arrange for you to be seen physically if needed. And only about 5% of people that access us need that type of service.
Okay.
So that's how it kind of started. And Dave is a good time of his career to kind of step away from what he was doing. I took a leave. I was in children's emergency full-time as a pediatric emergency physician. And it was something I just wanted to try. So I took a leave for a year to start this. We bootstrapped it for the first 6 months. And then when we really... I'm going to use all of Dave's phrases, but when we realized this dog was ready to hunt,
then we were off to the races.
Then we started. Then we got some private equity funding from just friends and family type stuff to make sure that we thought this was a good opportunity to build this quicker.
Right, right.
And I think for us, it was really the challenge of seeing if it was possible for us to create a system. We felt it was really important to work within the public system, right? This whole idea of only folks that have private insurance having access to virtual care, it didn't sit quite right? And so this whole thing was really about, can we make this accessible for everyone?
Right. And so as long as you have a provincial health card,
right,
regardless of geography or socioeconomic status, you can be seen on QDoc, no problem.
That's exactly right. Yeah. And the only requirement is that you're actually in the province of Manitoba.
Okay.
Right. That's all, right? Is, for now, as we expand into other provinces, that of course changes. But for now, you have to be physically located here. But you could be from Alberta, visiting family located in Manitoba, and you can be seen on our platform.
Okay. Interesting.
Yeah.
Now you mentioned earlier, the dog on the hunt thing. I'm interested in that. I want to double click into it. So was there a point in the first 6 months, you said you bootstrapped this, then you realized okay, there's something here. Mm-hmm. Was it a certain amount of patients you were seeing monthly, or what was it that made you realize, we need to start raising capital?
Yeah, so we wanted to make sure that it was a sound business plan. Like, so we've done some businesses together. Like, we started with a couple of our partners, a clinic called the Minor Illness and Injury Clinic on Court in Harrow. It's the first urgent care clinic outside of a hospital.
Okay.
About 7-8 years ago. We've done COVID testing site, did a penicillin allergy clinic. We've done a few projects together, but this was going to be bigger. And so what we understood that patients seeing a doctor by video from home was going to be a no-brainer for patients. Why wouldn't you want to, if you could, not have to drive anywhere, not have to drive hours if you're rural, not have to fly out if you're northern, and actually see someone by video? Like, it made, but we want to validate it. So we did questionnaires, like 100% pretty much of patients said, yeah, I would use this service. And it helps that it's, for them, it's free, right? It's within the public system.
Yeah.
We all pay through taxes for this, but for them, it's basically free. So who wouldn't use that? The question we had, will doctors do it, right?
Right.
Because there's a certain amount that you need as a doctor to get paid in order for you to want to do this, as opposed in your free time, right, which is most times when you do it. Nobody really does this full time, but doing it in your free time. So that, in that way, what we did is we sent out questionnaires first. Doctors said they would do it, but I kind of went a little further than that. I actually set up an application before we had anything ready, and got them to send in their banking information and everything like that to make sure that people actually truly will sign up to do this.
Right.
We got enough doing that, and we said, okay, we'll build it, which Dave did. So I hired a couple programmers, built basically very rudimentary MVP, which I think everyone should do, as opposed to trying to build something like for millions and millions of dollars at first.
Right.
All it could do is allow someone to sign up, a doctor to sign up, and a patient and a doctor to be seen by video together. Didn't allow anything else. You had to call in prescriptions at the time. We couldn't bill at the time. So we just wanted to make sure that that worked.
Yeah.
And it's like 5 months after we started, that worked. We saw in 2021, we saw like 50 patients. And that's when we decided, okay, this is going to work. Now we just have to scale. We have to build it better and scale it. So we have to step back from the MVP part, build a lot of functionality around it, and then start to build. And then by May of 2022, we didn't advertise, but we started to allow people to report on us. So we had almost immediately, because it's a cool idea.
Yeah.
We had, newspapers and like radio contact us.
Yeah.
But we didn't want to tell anyone about us because we didn't have enough providers. We didn't have the functionality we wanted. Right. So, but by May, we were able to start to do that.
Yeah. Okay.
Yeah.
So I guess, like, what's the main barrier? Like, why would a doctor not want to join QDoc? Is it just simply like...
There's a couple of reasons.
Yeah.
There's one is it's not for everyone.
Right.
It is, a lot of people like, and I like being hands-on. I still work as a pediatrician, and I like hands-on. Like, I don't want to sit in front of my computer screen just seeing patients over and over. It's not is part of my job, which I like.
Okay.
But it's not, I don't want that to be my 100% full-time job.
Okay.
Some people may not feel comfortable with and not know all the functionality that we have. So once they get on, they understand.
Right.
But to get someone to understand, because when people think of virtual care, they often think of a phone call.
Right.
It's not a phone call.
Right.
This is a video. This is by video. As a pediatrician, I can see the kids running around.
Yeah.
I can get them to take off their shirts and see how they're breathing. If they say something difficulty breathing.
Yeah.
I can get them to speak to me and tell me how things are going. I can direct the patient to do some physical exam items. That's hard because there's a lot. It's easier for me to do it than explain to you how to do it.
Yeah. Yeah.
Right. And then we have IoTs, so Internet of Things, right? So we can see heart rates, and so if you have it, right, we can see heart rates. People should upload pictures. You can upload videos. There are IoTs that allow us to hear breath sounds, hear heart sounds. So it's not just you picking up the phone and saying, "Hey, how you doing?" Like currently, like HealthLinks is, or
It's a visual component.
There's a visual and much more to it. And once people do that, then they understand, okay, yeah, this is much more robust.
Right.
However, there's this impression that it's easier than in person. I somewhat disagree with that. It's rewarding for sure because you get to see people are so happy to be seen in their homes.
Yeah.
But when you're a doctor going from room to room to room, patients are there. They're already, in their gowns. They're ready to see you. They have their whatever their problem is exposed, like if they have a foot problem, their shoes are off and whatever, you go from room to room and you're seeing them, it is often easier than the video where you're like, okay, now I talk to you, parent. Now I have to see your child. Okay, they're in their crib. Okay, we'll go over to their crib now.
Yeah.
Okay, now I need you to take off their onesie. Okay, great. And now, so there is some elements to that some people like and some people don't like. I love it because I think it's cool to see people in their homes.
Yeah.
And you get a lot more information from that. But some docs may not, right? And there's also the remuneration part, right? There are a lot of things that pay really well in medicine. And this is okay.
Yeah.
This is good, but it's not like you're, it's not like a gold mine here. Like
It's not the same as like an emergency doctor or something like that.
No, I mean, it depends how you do it, but you could, and it's what you like, right?
Yeah.
There's some people like doing certain things more than others, and it's not for everyone. But there are almost 4,000 doctors in Manitoba alone, right? We have 300 providers on the service right now. Some see lots, some see less. So we have a big cohort. And one of the things we found very successful is when we started using nurse practitioners. And that was with the provincial government realizing that nurse practitioners are, less expensive and they're really high quality.
Yeah.
Especially when we have...
They can also prescribe, right?
They can prescribe.
Right.
And we have a group together. So nurse practitioners and all of our doctors are in a massive group.
Okay.
So if a nurse practitioner has a question, they're not on their own. They can put a text into this encrypted chat and I'll answer as a pediatrician, or we have obs-gynae on, we have ophthalmologists on, we have a bunch of specialties on.
Massive brain trust.
Yeah. So if they have a question, even a logistic question, I don't know Thompson very well. Like, is there a surgeon there I can refer to? I don't know, whatever part of. So because we have so many providers now, we get those answers, right? Yeah.
That's cool. I wasn't being like facetious by asking that. I was genuinely curious because to me, it's like, if you're a doctor and you have I don't think pre-pandemic anybody thought doctors could ever work from home. Right. Ever. That would ever happen. And now we're seeing it like doctors are humans. They're just like anybody else. And now they have the option to be able to work from home.
Yeah.
And see patients, not to mention the mission of what you're doing is really cool. Like you said, like you get to see people from the north that would have never been able to come here. See people that maybe, would have waited 10 hours in a hospital. So the mission is definitely there as well. So, I mean, so
our mission is to provide equal access to quality medical care to all, regardless of geographical location or socioeconomic status.
Right.
So anyone can access us, but we find last time we did metrics on our whole amount of patients seeing us, 70% from outside of Winnipeg, whereas 70% of people are actually live in Winnipeg, right?
Yeah,
high 60s. In Winnipeg, even we have relationships with DCSP, the Downtown Community Safety Partnership, who you should have on actually. They're pretty cool.
Yeah.
So they take care of the homeless, right? So, a homeless person, they really often don't want to go to hospital. They don't want to be taken anywhere. But if they can be seen from the streets, then it can help them immensely.
Sure.
And the example I usually give for this is, you can have like a scratch that needs a topical antibiotic and you'll be okay. But if you don't take care of that, then it becomes a cellulitis, like a more significant skin infection.
Right.
So you might need an oral antibiotic.
Right.
You take care of that. Now you need IV.
Right.
You take care of that. You go septic and you need ICU for 3 weeks. And of course, you don't take care of that, then you
lose your fail.
Yeah. So it can go from getting this early and go from using a topical to having a 3-week stay in ICU.
Right.
It happens.
It's a game changer.
It is. For certain people it is, and for the system it is too, right? So we also keep metrics where we ask the question where you would have gone if you didn't have QDoc. And month to month it changes, but 15 to 25% of people said they would have gone to emerge. So we see 11,000 patients a month now on average, right?
Wow.
So we're talking about 2,500 to 3,000 patients that don't present to an emergency department in Manitoba because they have access.
Yeah, that's amazing. What's holding you back currently from, like you said, it's Manitoba only right now,
right?
But from going to Alberta to BC, is it just provincial regulations for the most part, or what is it?
Well, I think it's a few things. I mean, there isn't anything I don't think holding us back. I think it's we wanted the model and the software and everything to be really, really tuned up, right? So Manitoba was our first place. We're ready to go to another province, but our model again is having local physicians, right? We are all about having local where we can as the first option.
Okay.
There's the payment side which Norm can speak to, The reimbursement for physicians has to be at a level that they're interested, right, in performing duties as a physician or a care provider.
Right.
But I think those are the only two pieces, really.
Interesting.
Yeah.
Healthcare is like a very regulated area with probably a lot of red tape. Has there been like one specific hurdle for QDoc that's been like the toughest hurdle to jump over?
Toughest, no, like we always find out, there's things that happen for sure.
Right.
There's different regulations in every province. That's a challenge.
Okay.
When you're trying to work within the public system, if you want to go private or insurance, way easier because you don't have to deal with that kind of stuff, right?
Right.
But you still have to deal, I guess, with some college regulations. But there's regulations of College of Physicians, Surgeons in each province, different rules. There's College of Nursing, each province, different rules.
Right.
There's our Docs Manitoba or OMA, the Ontario Medical Association, so that's the lobbying group for physicians. They have different focuses on sometimes. So you have to really understand what people want and what they need and what their biases maybe are in order for us to get into certain areas.
Yeah.
But your question about our business and the business side of it, like we've evolved quite a bit. So really what I consider us now is a med tech company.
Right.
So more than half of our staff are developers. So Dave leads a team of 19 developers. Wow. So they're all Winnipeg developers.
Like all software developers. Yeah, and they're all employees, right? We don't outsource. That's a large differentiator these days, right?
Right, right.
Yeah.
They're not independent contractors. They are employees.
They are employees. Yeah, the only people touching code for security, privacy, all of those reasons that you were alluding to, right, in the healthcare realm, we keep that control very tight.
Wow, that's great.
Yeah. And although we started with virtual care, we're now a 3-product company. So we have, QDoc Virtual, and then we have to bill, right, the provincial government for physician billings. And then the way that works is the money comes back to us and we take a percentage.
Right.
And
has that helped you attract more doctors because of having that?
Well, it's you work. Yeah. You don't pay anything for the platform.
Right.
And you come on, whatever you work, you get paid.
Right.
So doctors who work anywhere, there's some payment that they have to make for the infrastructure to be available to them. Right. So when you go to see your doctor, or assuming you have one, if you go to see your doctor, you go in, you check into the clinic, you get seen, and you leave. No credit card required, right?
Right.
It's a provincial health card.
Yeah,
that's the beauty of the Canadian system. It's covered, right, for you. So what they have done in their clinics is they've created a physical infrastructure, allowing you to meet your doctor, and you don't pay anything. But the only way they keep their lights on is that they bill for the docs. The money comes back to the clinic, and the clinic takes a percentage of the doctor's income in order to keep the lights on.
Right.
We're exactly the same thing.
Right.
We are a large virtual clinic, independently run, provincially funded. Yeah. And we do this out. That's exactly how we keep our lights on as well.
Right. And when you say they're billing the government.
That's right.
Yes. Okay.
Yeah. That's how one of the mechanisms. Sometimes in certain areas of the province, you may be like emergency docs.
Yeah.
Mostly in Manitoba are salaried.
Right.
Some of the provinces are not, but they're salaried.
Okay.
So you get a salary, you don't bill anyone. You're there.
Yeah. So I'm glad you explained that, because I feel like a lot of people go to like a walk-in clinic, they just have their health card, they leave, like you said, they don't pay anything. And it's like, well, who is paying for all this? Well, it's the government, but at the end of the day, it's the taxpayers.
That's right. Yeah.
So tell me about like the intersection of when you realize like this is probably more of a tech thing than it is anything else.
Yeah, I think we realized when we started with the virtual care side, we realized as we were building it, and we built the billing module, that we realized this billing module could be better than anything on the market. So right now, when you go to your doctor, yes, they bill the government, the clinic will bill the government for you, but often they're using a billing service. So their staff may put in some billing codes, and then a billing service will then send that to the government. Government may say, okay, we're not paying for this and this and this. And that billing service then has to go, okay, no, you should be paying for this and this and this. Here's more information for you, right?
Right.
So we were already doing that because we had the virtual side. So we decided, okay, this could be a really, really good, not side gig, but a secondary income stream. So we created a billing company.
Yep.
And that's a second part of our business is now medical billing. So we do medical billing for QDoc Virtual.
Yep.
And so Q billing, which we would call that side.
Nice. Yeah.
Q billing is the client, is a Q virtual, is a client of Q billing.
Yep.
But we also have 75% of our income from Q billing comes not from QDoc virtual, it comes from physical clinics across the province. So we take in now we take in, and we're going to be growing that side significantly in the next 1 or 2 years.
And it's separate software. So it's interesting, right? So we have the virtual platform that we originally started to build. And then we also built Q billing software separate. Now, of course, they're tightly integrated,
right?
But they run completely separate.
Of each other.
That's right. Yeah.
That's interesting. So yeah, when you hear of Q billing, I would have thought that it's just handling all QDoc's work, but it's actually servicing a ton of other clinics and pharmacies or whatever throughout the province.
Yeah.
It makes your organization probably much broader, deeper.
Well, allows us to not rely on one income stream.
Right.
And we don't know which one's going to be the biggest income stream as far as like net income goes.
Right.
We know that from a service point of view, we're most proud of the virtual side because we help tons of people every month. But from a net revenue point of view, you don't know. Maybe this one was the one that's going to feed or help feed the business, so we can expand the virtual more.
Yeah.
Maybe it's our third line, which is we built some booking software, which is used by the government now. It's called MediNav. It's really cool. It's called medinav.ca if you want to go to see it. But the way that works is, and just to back up, if you had a problem, like you had a ankle sprain or you thought maybe you broke your wrist or whatever, what would you do? You would either go to an emerge, or you might call your doctor who says, okay, come see me. Often they can't be available 24/7. So often they may not be available, or they might say, come see me next week. And you're like, well, I can't wait a week, right?
Yeah.
Or you might call an urgent care clinic, and then they don't have something. So you call the next one,
Yeah.
So the way this works is you go to one site, you put in your problem, and it'll display the first available appointment within the next 48 hours for 15 clinics that are currently in the software.
Oh, wow.
And we query all of those clinics, all their schedules in the background simultaneously. So instead of you calling 15 clinics,
Does all the work for you.
it does. Yeah. It does all.
And then it doesn't work for the clinic too. So we do, once you said, okay, I like this one, book it. It sends all the data to the clinic's electronic medical record.
Right.
Puts you into the clinic and you're booked. And so
You know what
you just
time.
show up and you're there, right? So you don't have to worry about
Waiting
calling
20 hours.
tenors.
Yeah.
Yeah. So, and that one we're trying to expand right now to, like, it'd be great if it was every clinic in Manitoba.
Yeah.
You never have to go anywhere else. You go to this one site and you get an appointment. Why bother calling 20 different clinics, right? If you have your favorite clinic, you can still call them and still go to them. There's nothing stopping them from using their own booking software or using phone to call them. But if you just want to get seen, you could just go to the one site. Right? It makes a lot of sense.
So it's great for all of those illnesses or issues that are not suitable for virtual care, right? The QDoc could help you with, right? That you need to be in person. Like, this is a great central place to go, right?
Yeah, no doubt.
And
Amazing.
Yeah, it's very cool.
Yeah.
So I want to step back again to just like the years and progression here. So 2021, you did 55 patients. Now you're doing 11,000. Was that a pretty gradual uptick year over year? Or was there one year that it was just like, it just exploded exponentially?
Well, there was the first year, this first year we did 55. Second year we did about 12,000. Third year we did about 50,000. And then this is our fourth year, which we did about, I don't know. I think about 120,000. So, I don't know. Is that gradual?
I don't know. No, I guess more logarithmic.
Yeah. It's to me, when I think about our future, it's gradual.
Yeah.
Because I think our future will be much quicker than that.
Right.
We're just getting what happens what happened in our business. And I think in many, many businesses, you build the infrastructure for a certain amount of volume. Doesn't matter what business you're in, really. You're building for, let's say, $1 million in revenue. And you're like, okay, I actually have to now step back. I have to redesign my business now. So now I can get to the 10 million.
Yep.
And then now, okay, I have to step back again now so I can get to the 80 million. I have to step back again so I can do the $500 million. You have to keep reinventing your company with those 3 to 5 year timelines in mind.
Right.
So that you're set up for that growth. If you don't do that, you can have as much growth coming to you. You won't be able to handle it.
Yeah. You won't be able to service it properly.
Yeah.
Yeah, absolutely. Okay. What do you think is the next step for QDoc in terms of growth? Like, is it expanding to more provinces, seeing more people here locally? what would be best for you?
Well, I mean, over and above, so in Manitoba, our rate limiting step, because I think you asked about that before, is providers, right? Is doctors and or nurse practitioners, right?
Right.
So, if, as an example, during this particular period of time, flu season, right? High demand, right? QDoc is in high demand because people are sick; they don't even want to go anywhere.
Absolutely.
So they're on QDoc, and of course, if we had more providers, well, the business would scale, right?
Mm-hmm.
So that's one area. The next is, as you said, new provinces, right? Like getting set up. It's a bit of a cookie cutter, right? Launch in the next province. Billing is totally different, right? So as Norman said, although healthcare is federally funded, it's administered by each province, and each province has a totally different billing system.
Right.
All the codes are different, right?
Yeah.
So, but the advantage of what we built with Q Billing is it's ready for that, right? So, okay, we want to go to Alberta next. It's just small work, right, to be compliant with their specification for medical billing.
Right.
But yeah, that would be our growth, right? Our strategy for growth, and whether it's in all three of our products or it could be one of our products, right, as an entry point.
Yeah.
That's definitely our plan.
Very cool.
Yeah.
And is this set up mostly just for public healthcare, or could it also apply to, like you had mentioned, independently operated?
Yeah.
Private in the future.
Yeah, so it could. Right now, we're working within the public system, independently operated, just like all clinics.
Right.
But we're working within the public system, and that's kind of where we want to be because we love the idea of servicing the underserviced, like I mentioned.
Yeah.
However, yes, we could easily, and we do already do some private, very small.
Right.
The only ones are, people are visiting from the U.S.
Right.
They pay by credit card. They get, reimbursed usually by their insurance, or they're visiting Quebec because there's no reciprocal agreements from there. They may use us, they may use credit card or whatever. We had built direct integration because we were servicing the Red River College, and they wanted all their students and staff as opposed to just the ones that have provincial health cards.
Mm.
So we worked with that. Their insurance company to do direct billing with that. So So that's a little bit of little things like that.
Right.
But there are certain things that aren't covered, right?
Yeah.
So, when we get into some allied health, so physio, if we want to do some physio intakes or speech pathology or psychology, things like that,
like different types of clinicians.
that will be private pay, private pay and insurance coverage, right?
Yeah.
Because that's not covered by provincial health.
Is there an opportunity for QDoc to expand into like the United States? Like that type of private healthcare?
Absolutely. Yeah. I mean, obviously things are different.
Yeah.
The funding is different. The payment model is very, very complicated, right?
Right.
And again, everything that we built is kind of built with that in mind, right? So our billing system, we kind of looked at if we move to the States, there's all these different insurance companies. And not only are there all these different insurance companies, before a patient can actually even be seen, they have to get pre-authorized, right?
Okay.
With their card, right? And so it's all of those complexities that we've kind of been thinking about. We have built the back-end architecture to support those, but those features don't exist right in the front end of the product today.
Yeah.
So
what I love about tech companies is you take like feedback from real users, whether it's like patients or doctors, nurses, clinicians of any kind. Has there been specific feedback you've gotten from patients or doctors that you've like recognized right away and implemented right away?
100%. Always.
Examples?
So we get mainly from docs.
Okay.
We get lots and lots of feedback, and they're iterated pretty quick. With 19 developers, you can go, okay, this is too many clicks. We want to limit that. Okay, we'll limit it. Like it's right away from our billing platform. Like we have, because we want to scale it and we want to make it the best billing platform available in the market. We have people that have used different billing platforms, and we take the best of all those and we go, okay, yeah, this could be streamlined mainly it's going to be for our billing staff to make their jobs more efficient, right? Mm-hmm. Or this can be streamlined to make sure that the doctor sees more information. They see everything they need to see. And so it's daily.
Yeah.
Like these things are daily. So one example that's a bit bigger that we're trying to work on is, and people always ask for, is wait times. So we had We had a big session yesterday
Oh, cool.
on figuring out, okay, how to make this
how
wait
long-
time.
Yeah. How when
Right. So
patients
if I like
on,
log into QDoc.
yeah, how long am I going to be waiting?
Yeah.
Even though like on our platform, you don't have to actually wait, right? Once you're in, it'll text you, right? And say, hey, doctor's ready for you. Now you just kind of come back and get set up again. But despite that, people still want to know, well, how long, right? Am I into this thing for 2 hours? Many times they're seen within 15 minutes, right?
Yeah.
And but there's all these complexities around, the number of providers on, what type of issues people have, right? Visits take, it's very dynamic, right?
Right.
So yeah, we had a great brainstorming session yesterday, but that's the highest, as Norm said, that's one of the highest demand features when we talk to patients and when we hear feedback from patients is, I'd like to know something, right? Just tell me something about how long I'm going to wait.
Yeah. That's going to be a tough one to implement though, too, I would imagine.
It is still not sure how. We know the problem is. And like Dave said, the problem is like, if I still work as a pediatrician, and if I'm in Southern Health region,
right,
and I wanted to see some extra QDoc people, I will usually pick people from Southern Health, right? And there'll be kids from Southern Health, and I like skin and MSK, so I will preferentially pick kids that have dermatologic problems from Southern Health. How does our software know that I'm happen to be on doing that? So these ones might get seen way quicker. Where somebody else that's an adult, maybe there's like less adults on and they're not going to see women's health. Maybe there's no one on at this point, or there's one person on that sees women's health and there's 10 pediatricians on.
Right.
The kids will get seen like that. The women's health might wait hours, right?
Yeah.
So, and things like, we know some of our metrics, like things that doctors gravitate towards because some things are easier than others. Like a prescription refill, we know in May when we did our data, it's 3.5 minute wait. That's it, on average.
Wow.
By the time you say, I want to see someone to get you seen, right? But if you had a mental health issue and there's not a lot of providers that want to see mental health at that time, then you might wait longer, right? Much longer than that. So can't be generic. It has to be based on the particular patient, their problem, their age, location. That's a very difficult algorithm for us. So we have to do some machine learning.
It's really cool, right?
Yeah,
like cool from a machine learning, right? AI, large data, like all the things that technical people dream about.
Yeah,
it's great. It's a wonderful problem to have, but it's a tough one in our environment to solve. And also, our physicians and nurse practitioners also can come on for just a minute. Let's say that they were working in clinic, but they get cancellations as an example, right? Well, okay, I might as well, instead of not getting paid for my time, might as well hop onto QDoc, right? And do a few patients. Well, that is great for the system because we get these extra physician hours, if you will, right? That wouldn't normally be used. But at the same time, it's very unpredictable. How long will they be on? Right?
Yeah. It's a tough algorithm to create.
It really is. Yeah, it's going to be a great problem, and it's an exciting one to solve. Almost as
a couple of our developers were super pumped and stoked to try this. Try to figure this out. They were very excited. You'll see how it goes.
Yeah. No, I love the technology behind it and the AI and everything you guys are using. Because I remember I took one of my kids to the doctor not too long ago, and the doctor was writing up a prescription and was like, "I'm going to fax this over to the pharmacy now. What pharmacy are you at?" And I'm just like, "Are we still honestly using fax?"
Yeah. Yes. So you hit on my favorite topic, inadvertently, but yes, like here we are, right? 2026, and the lifeblood of healthcare. Is still faxing, right? And we're working hard
but it's not from our perspective. Like,
we're ready to go. Like, there are standards in place, like, as an example, the FHIR standard, ID, IHE and XDS. Like, there are all these standards that have been in place for many years, to be honest with you.
Right.
The sort of uptake and adoption of those standards is slower than molasses, right? And your point is well taken about pharmacy, right? And we feel pharmacy is very important for us at the moment because we see a lot of rural patients, and patients often have to drive from their house,
right,
25 or 50 kilometers away to a pharmacy to pick up their prescription.
Right.
Well, when you're using fax, which is just this feed forward 1970s technology, the paper can jam.
Yeah.
Right. Like, there's all kinds of things that can go wrong, and the patient doesn't really know. Right? Is my prescription ready? Did it even get there?
Right.
So we're looking at all kinds of ways, again, from a technology perspective, the framework exists to solve the problem.
Okay.
But the willingness for other vendors to kind of participate is where the issue is.
Like he set it up so we can send electronic. If a pharmacy says I can accept electronic, we can send electronic. It's like a switch of a button.
Yeah.
Because they use like what's Mirth called? It's a
we use an integration engine,
yeah.
And prior to Norm and I doing this work, that was really where I spent most of my time, was where that type of work, those integrations, those electronic integrations. So everything that we built is kind of built with that in mind. Right.
Future. We're saying fax is going to go away, which you've been saying since the 80s.
I've been saying that since I started my career. So that's frightening.
But you shouldn't be able to. You shouldn't know more about your pizza delivery than you do about your prescriptions.
Yeah.
Like you tell Domino's, you go on, and you're like, oh look, they got it.
Yeah,
oh, they're preparing it.
You know, Bob's making the pizza, right? You understand that.
Yeah.
We can't tell you that your prescription was at least being filled.
Even received. Again,
well, maybe that's the next thing is Q Pharmacy, and you guys have your own.
There you go.
Your own pharmacy, and that's going to be shipped right to their door.
Yep. But it's between that and the other area that we're very focused on is, of course, intake and referrals, right? Because referrals are very similar. Like you can go see a doctor and you can see somebody like Norm and be referred on to a specialist. And that's an abyss as well, right? Like that travels via fax, right? Well, okay, did the fax get there? You know, where is it in the queue? You know, like where are you in the queue for that specialist, right?
Right.
So we're building this entire kind of intake workflow, right? Where we can tell patients eventually where you are in your journey to a specialist, right? Because that's another really important one. So pharmacy and specialist referral, we see as really for this year, I'd say, top of mind, right?
Yeah. Talking about another area of growth, like that's what we're launching on January 20th. And it's the first one we're doing is ADHD, an ADHD clinic, but it's all internal. It's all through QDoc. So when you come on, you get a screening questions, then you go to, you see one of the providers. They also have a vetted questions that have been vetted by ADHD specialists to kind of go through with the patient, make sure that they get all the information they need for the specialist. That could present it to the specialist, who then goes, okay, I need you to fill out these forms. They just check them off. They get sent directly to you electronically and to the teachers, for instance, if it's ADHD.
Yeah.
They get all filled out. They come back. Then you book an appointment. You see someone by video. But all those steps, because they're all internal, we can tell you what's happening, right?
Yeah.
You can say, okay, your referral has been sent to the ADHD group. Okay, Dr. A has picked up your referral and is looking at it. Dr. A sent you forms. Please fill them out.
Right.
Dr. A's forms are filled out. You can now go online and book an appointment.
Yep.
Like you can know all of this stuff, right? And that is generically built. They built it generic so we can do that for all clinics. ADHD is probably one of the most complicated ones.
Yeah.
And
is that live right now, the ADHD one?
It'll be January 20th.
January 20th.
Okay. Give or take.
Yeah. We'll be on time, but January 20th is the launch date for that. And the nice thing about it is there were all these paper forms that used to circulate.
Yeah.
Right. This is all electronic, right? Like, the teacher, as an example, like for kids, can go on, fill out that form electronically, and it's there. When everything's ready to go,
right?
Big check mark on the bottom. And now the physician, the specialist, has all the data they need to now have that meeting, that diagnosis.
And again, there'll be iteration after iteration for this, but we do the best you can at the first part, get it launched. You learn a lot from the community then.
Yeah.
You learn a lot from the patients, from the doctors. And this one is going to be from patients, from the nurse practitioners and the doctors that refer, then the specialists that are taking those referrals in. So we'll get feedback from all those. And once that's running like really, really well, which it will probably right at the beginning, but we can make it better and better. We should be able to help, the provincial systems like Central Intake and METC, Maternal Adolescent Treatment Center.
That's an interesting one because I'm actually I'm going through that right now personally with one of my children who's 8 years old, and we're going through that ADD. Does he have it? Does he not? The teacher thinks he might, but the doctor kind of disagrees. And it'd be interesting to have all that in one central portal. Right?
Yes.
So, what made you guys think of that? Was it just the demand out there for it?
You wanted to do it for years, actually. Yeah. Years. The thing is that, you try working with the biggest intake right now is called Central Intake. So Central Intake, that's provincially run. They take in a lot of mental health and ADHD referrals from everywhere.
Yep.
Self-directed, from doctors. And then what they do, they look at it and they send it over to their ADHD clinic.
Okay.
If that's what they think the main problem is.
Right.
Before COVID, they had about a 3 to 4 month waiting list, and their focus was on more complicated ADHD. You can't do really complicated stuff.
Right.
Complicated stuff means you have morbidity. So they may have a history of autism. They have a history of significant behavior difficulties, some learning disabilities associated with it. But they wouldn't do a lot of the simple ones. After COVID, their wait list is 2 to 3 years. So we try working with them to try to create something together.
Mm-hmm.
It's difficult, right? Because they have their own processes, and we found it difficult to do. So we decided to step back. We're going to build our own. Once it's running well, we'll go back to them and say, listen, this is what we do. This is how we do it. This is why it's so streamlined. And they'll want to use it. So it's going to be a great place to get all the, to be able to filter those to the more complex and the more simple and get it to the right providers. Because part of the problem in healthcare is you may have had this experience, you may not have. Sometimes getting to the right provider first is sometimes very difficult.
Mm-hmm.
So the right place, right time, right person, you need the right match, right? And that's what we're trying to get to.
Amazing. What was the journey like from going from your careers individually to now leading a team of, you said, I think it was like 30 people, maybe a bit more. Like you've gone from doctor and tech guy to like basically like CEO and president. Like those are very different positions. Now you're managing large teams. People rely on you.
Mm-hmm.
Tell me, like, how has that changed you guys individually as people?
Want me to take that first?
Oh yeah, you go first. That's a good one.
Yeah, I mean, so for me, I think it was it was a progression,
right,
through my career. So I started off as Peds Emerge, but I was always interested in flow, like patient flow, making things more efficient.
Right.
So did a couple projects in the Emerge to make things more efficient particularly for people that came in with gastroenteritis or fluid issues, and people that came in with injuries.
Okay.
Then shortly after that, 2004 had a group a little group that started taking care of all the kids in Western Manitoba. So before we created this group and contracted with the government really with that, they had to, like, every high risk delivery had to be sent to Winnipeg from Brandon. C-sections had to be sent, like they had enough coverage, right? So from 2004 till now, we've had 24/7, 365 coverage of pediatrics in that area. Then I started the minor illness and injury clinic for kids, which is a Pan-Am.
Yeah.
And we see about 8,000 non-surgical trauma for kids, basically everything in Winnipeg and surrounding area.
Wow.
Per year there. And then we started this minor injury and illness clinic on Cordon together, which sees about close to 50,000 visits a year it's all emergency physician that work there.
Okay.
Started that COVID site. So there's been some like COVID site, a penicillin allergy clinic. There's been a bunch of stuff that we started.
Right.
But to your point, not managing a lot of people, right? There may have been like a team of like 5, 6. Maybe if the COVID one was a little more, and we put that together in a week. So that was a really good learning experience for us. But part of it for me was I realized that Dave and I, neither of us had a lot of business besides those projects.
Yeah.
Which is, I guess, more than a lot of people have for business side, but not the scale that we want to be in.
Right.
So we got some really good advisors. So we have 3 that have built businesses themselves. 2 of them IPO'd. So we got 3 advisors to be on our advisory team.
Yep. And
then also engaged with North Forge Technology Accelerator, which you probably heard of.
Yep.
And went into one of their programs, and because even though we had some knowledge, there's gaps, right? You may have 70% of knowledge in this area of business, and then when you get a higher level, you have 50% in this area, but you want to fill out that 70% to make it closer to 100, right?
Yeah.
So we started at their base camp, and then we in their accelerator program, and that was really quite helpful. And meeting this new group of amazing people that are entrepreneurs is pretty cool, because that's not something I had have experience with. Like, you're in the medical community, great community.
Now you're stepping into other the technology community,
you're a tech
right?
and entrepreneur community, which is like amazingly supportive.
Yeah.
Like, just great. And so we just want to help. I'm really in a position where now I really want to help the whole community, because as a good friend of mine always says, rising tide floats all boats. So we want everyone to be successful. All Manitoba entrepreneurs, the ecosystem to be successful. Sorry, I'm off topic here, but But basically, like we've had a lot of help along the way,
Yeah.
and we want to also help others along the way as well.
But yeah, I've been, same idea, right? I've been really fortunate, and my whole career has been in the medical technology space, right?
Okay. Yeah.
And so in my early days, I was in the X-ray, MRI, CT business. So I worked for a large Dutch company called Philips, and did quite a long stint there, right, in my career. And the neat thing about that is, while it's not entrepreneurial, which is very different, when you're working for a large, company, right, that's global, you get trained a certain way, right? Certain way to think, certain way to do business, and everything's about process, right? And having good operating procedures so that when you're done, whatever it is you were doing, someone coming along can step in, follow that same kind of recipe, and the business can keep going. So, from my perspective, the things that have been helpful for our business has been that I kind of came out of this organization with built on process, right, and structure. And entrepreneurial life is not always like that, right? As you know.
Yeah, it's very spontaneous.
Oh yeah. And it is, that's why Norm and I are, I think, one of the reasons that we work well together is we kind of play off each other on that stuff, right? And we're able to kind of work through those type of issues that entrepreneurial business throws at you, right? And then from there I moved into commuting to Alberta. So I lived in Winnipeg, but every week I commuted to Calgary.
Okay.
And I worked for two large radiology groups in Calgary.
Wow.
And we ran their entire operation. And actually we took them from film, right? Which, I know seems odd to talk about now, but that's how X-ray used to be.
Yeah.
To digital. And that wasn't all that long ago, by the way. It was 2006. And so we ran that for 17 years and commuted from Winnipeg every week via Air Canada. So that was...
So we get upgraded a lot when we travel now.
Yeah. So they're still pretty good to me. And again, that was a pretty neat business because I got to build things that not only they help patients in two sides. They help patients because we would, for example, build technology that allowed remote communities to have all of the X-ray or CT or whatever they had interpreted by radiologists based down in Calgary. So now you're improving the turnaround times, right, for patients. And some of the best stories are like in Northwest Territories, for example. They would wait often, right? Patient would come in with an injury. They'd be waiting for the radiologist report to decide which direction that patient needs to go.
Yeah.
And they'd be waiting for a very long period of time. When we built the systems that we built, all of a sudden, it was just like they were in a large metropolitan center, right? The radiologists down in Calgary were reading them real time, right? Patients could move around much quicker.
Okay.
So that's really what gets you addicted to this type of work, right? Is that you see immediately the benefit for the patient.
Yeah.
And then the rest of the time, it was really optimizing radiologist workflow, which is still an area that I'm very passionate about, because the faster, the more accurately that physician, radiologists can interpret studies, that means the patient care also accelerates, right? Patients can get cleared from the emergency room quicker, right? So those two areas anyways help drive out kind of what we're building today.
Yeah. That's awesome.
Yeah.
So you guys have gone from obviously like employees to now entrepreneurs for quite some time now. And as you know, entrepreneurship can be at times like tough, lonely once in a while. There's some burdens you carry sometimes. Like what would you say is like the one hardest challenge you've had, whether it was a QDoc or earlier that, tested you? Like maybe it was, a limiting belief or some sort of insecurity you had to overcome to get to where you are today. I'll start with Dave. Or I can start with Norm.
Sure.
Yeah, Norm always has all his insecurities listed.
That's right. I think you have mine listed.
Yeah.
You guys can answer the answer.
Yeah. We'll answer for each other.
No, I don't think. I think in some ways, fortunately, because of where we are in our lives, it's a little easier than others.
Right.
I have a pretty good backup plan.
Right.
Like a backup job. Like if I needed to. So making the decision to actually do it was difficult, but not overly difficult. Like if we had to bootstrap this thing for 6 months and then it didn't work, I could recover that in a couple of years, right?
Right.
A lot of people can't do that.
Right.
So we're very fortunate that way.
Right. Because your fallback is
my fallback is being a doctor, right? So it's not a bad fallback.
Yeah.
The decision, people think you're crazy, and the decision is, okay, you're going to leave this, pretty well-paying job to like do something that pays nothing,
right?
And you're actually going to contribute to it,
yeah.
But you're doing it for your future. You do it. I think you do it because you can't not do it. I don't know if that makes sense, but for me, it was, I would not forgive myself for not trying this, but I could forgive myself for failing on it. It's okay if we failed on it, but I could not think back and go, oh my God, I should have done this, right?
Yeah.
So that part wasn't as difficult. Raising money for us, I know it's hard for a lot, but at the beginning was not as difficult for us either. Because there's a lot of people that understand that this is a huge problem.
Okay.
And there's a lot of people that were already using it. And doctors that were using it. Doctors have decent incomes. They can contribute. They can actually invest in this stuff. I think the part that I'm still struggling with a little bit is this is a pretty good success for our local area, right?
Definitely.
We're seeing like hundreds of thousands of people. We're helping. We hit 250,000 visits last November, I think, of this year.
Okay.
It's a lot of people that we've helped, and so it's a great feeling to be able to have done that. I think my insecurity is this could be huge, massive. It doesn't have to be locally. We have the market. Like nobody else is doing a lot of virtual visits. But how do we expand this? Because I know we could be. This is if this is a $40 million company, it could be a $1 billion company.
Yeah,
there's no reason why I can't. That is limiting beliefs, right?
Absolutely.
That is something about expanding that and going, okay, there's no reason, like Dave said, we can't rinse and repeat this in other jurisdictions. Some will be easier than others. Manitoba is actually not the easiest one to do, which is good and bad. Good because we're here and we've done it. And it's the barrier to entry in Manitoba is pretty hard for others.
Yeah. I feel like that's an insecurity that a lot of people have is like, can we reach our full potential?
Right.
Yes.
Right. Like, I feel like there's so many people that feel that, myself included. So that's a good one though. Absolutely. That means you want to push harder. Right.
You have to be uncomfortable.
Yeah.
Like if you're not uncomfortable, then you're not pushing hard enough.
Absolutely.
So,
and that's very like humbling to hear that from somebody who was like a doctor. And, a lot of people would look at you and be like, oh, his life is made, he's a pediatric doctor. Right. But, you had something further to do. And I love that.
Well, it's also about I know everyone I think I've talked to that thinks about this imposter syndrome.
Yeah.
I feel like, what am I doing? How am I doing this? So who's to me? Why am I doing this? Right.
Right.
Like you said, like people think, oh, it's, you have it, you've done it, you're doing it, you can do it. Like, and you always have that question, right? Can we build it to this level? But, I think we were getting there. We have a lot of good people around us. We had a really good session and, as Dave said, you start as an entrepreneur, you start as a small business, you build it to a certain point almost naturally. Then you have to have a plan. You're a plan. Like, we want to be a $1 billion company. Okay. That's our 5-year, 6-year plan. Now, how do we do that? What do we have to be in 3 years to get there?
That's right.
And then what do we have to be in a year to get there?
Right.
And now what do we have to be in 3 months to get to the year?
Right.
What do we have to do in 2 weeks to get to that 3 month? And we see, now I can see that finally.
Yeah.
I can see that very concretely. And I'm like, okay, this is what we have to do. Oh, we hit our 2 week, which means we could hit our 3 month, we could hit our year, we could hit our 3 year, we could hit our 6 year.
Yeah.
Like, we have this plan now that we can get there. It makes me feel much more comfortable. At a certain point you have to do that. If you have to plan it. Plans change.
For sure.
I think
you have to have some plan. Right?
Yeah. I like that you guys have like these strategic goals that you've set out. And then not only have you done that, but you've broken it down into like actionable items. This is, if we want to get here in 5 years, we need to do this month, this by the end of the year. And the nice thing is once you start accomplishing those, like you said, you get this confidence, right? It's like, well, we accomplished the first goal. Let's get to the next one.
Yes.
And I love that. That's great, man.
Yes.
Dave, I want to hear about your insecurities.
Yeah. Well, so Norm kind of hit on the imposter syndrome, right?
Yeah.
Like it is really, really tricky. At least for me, it was, to feel comfortable in being involved in running a company, right? Being responsible for employees, right? And their well-being, right? And building a product that people want, right? And that they like. And so you have all those insecurities, right? And they're, and then you look at it in the morning, when you get up and you're like, do I really even belong doing this? Right? Like, is this really something I should be doing?
Right.
And then as you start chipping away at small successes, right? The goals, right? That we set, and you see those kind of happening, and you see your software kind of evolving, right? As you architect it and build it, you start to feel way more confident, right? And then you get to this point where like, yeah, this is absolutely okay. Right? We're in the right place, right? We're doing it.
Amazing.
But you're still, you're always fighting with that, right? Like, is this where you belong? And while I don't have a medical degree to fall back on or anything, I had this great career within diagnostic imaging, which is, kind of always still in demand. Like, that's not going away.
Yeah.
So there's always a plan B, but you're putting all your eggs in one basket, right?
For sure.
My kids are all still consuming money, right?
Yeah.
They're all in school.
Their consumption phase.
Yeah, they're still in consumption phase, right? And so you're always looking at this thing going, well, this is on me, right? Like, I still have to make a living, right?
Yeah.
And so the first part of it is always a little scary, right?
For sure.
But once you're over that hurdle,
amazing.
Yeah,
that's good.
That's good.
One thing that you just brought up that I wanted to touch on was like raising money. How many rounds have you raised so far?
So we did 3.
Okay.
The first one was friends and family.
Okay.
Second one was the second and third were both strategic.
Okay.
So the second one was all doctors, and really it was doctors. Every round I've turned people away. So that's why I said it's been easier for us. I feel bad saying this because I know how hard it is for a lot of companies to do it, especially because they're much younger. Like, my network is different than a network of a 20-year-old.
For sure.
And being a physician so it's a different network, right? So that's why it's been a bit easier for us. The second one, we were strategic. So we took mainly doctors.
Okay.
And then
that are on the platform.
That's smart though. Making the people feel like they've got skin in the game.
Right.
Right. Yeah.
And then we had, I don't know if I should say names, but we had a few doctors want us to meet with their investment advisors. One thing that was really, again, made me feel good about our business was every investment advisor we met with wanted to invest. So I'm like, okay, so we didn't let them all
personally,
but we let one invest, because the one guy that came to us immediately the next day brought another 3 people that were like significant investments. If they want, we didn't take them, but we took the initial guy, because I know in future rounds.
Yeah. Well, that's strong validation.
That's strong value.
Yeah.
And then we brought one person that is an amazing social media. I don't even want to say, but he has over 1 million, at least 3 years ago, he had over 1 million followers. Like, he was,
wow.
So I brought him in and said, part of you bringing you in, allowing you to invest in us, which is a pretty cool place to be. Whereas you're going to meet with our marketing staff.
Yeah.
Because we understand what you've been doing to do this. Like, how do you do this?
Right? Yeah, absolutely.
So, and then the third one was basically we just brought is mainly the same investors we had and a couple other doctors.
So it's pretty much mostly like people. It's not institutional investments at this point.
No, I've been meeting with them only because right now, because when the people approach me, I do meet with them often.
Mm-hmm.
And I just want to understand where what their investment strategy is, where we would need to be in order for them to invest in us.
Yeah.
If there's a good fit in the future with some of them. And I've met with some 2 or 3 times already.
Yep.
Because they come back, right? And I said, we don't need now, but this is where we are.
Yeah.
These relationships, I don't think people understand. There's some really crazy businesses that people just invest in, that they're like, they really want to. AI is really high now, right? And all that. But often this takes relationship building. It's not just like I got $10 million from this.
Yeah. It's not a transactional thing where you meet once, you get $10 million and you move on, right?
Very unlikely. It's relationships. It's relationship building. So right now I'm building these relationships, because whether or not we need it, there's nothing wrong with having these relationships.
For sure.
People understanding who you are. And if you do need to go, or you need to, and you have to do it, in my opinion, from a position of strength. You can't be like, I need money for next month's payroll, because that's weakness. And as an investor, you're going to be like, well, I'll take it. I'll invest in you, but I need it at third year valuation that you want. Right.
Right.
Like
right.
people will do that kind of stuff. Right?
Yep.
You have to be in a position where we have money, operational money for the next year or two, but we need this money to do this because of growth.
Right.
That's what people want to see, right? As an investor.
Yeah. Position of strength for sure.
Yeah.
Very cool. Well, guys, thank you so much for coming on.
Thanks for having us.
Yeah, absolutely. It's been a blast, honestly, learning about your business and how you guys have handled things. It's great. That's another episode in the books. This is QDoc. So if you're ever sick, instead of going to a walk-in clinic, check out QDoc. You'll get serviced way quicker and just as high quality.
Yes.
Peace.
Thank you.
Right on. Thank you.